Welcome to the deep dive. Today we're jumping into a topic you brought to us, looking at a specific health challenge for our feline friends. We've got this stack of sources you shared, all detailed excerpts on feline uveal melanoma, and we're going to, guide you through them, pull out the really important bits.
Yeah, think of this as your shortcut to understanding what this is, how the sources say it's diagnosed, treatment options, the outlook, the prognosis, and we're sticking strictly to the material you provided us.
Right. It often starts with something that sounds simple, maybe just a change in a cat's eye color, but as we unpack these sources, you'll see there's, well, quite a bit more to it, including this surprising potential for problems way down the line. Okay, let's get into these sources. The first things first. What exactly is feline uveal melanoma? The sources, they also call it feline diffuse iris melanoma, right?
That's right. According to this material, it's actually the most common tumor found inside a cat's eye, an intraocular tumor. It usually kicks off on the surface of the iris, the colored part, and it can then spread deeper into the ciliary body and the choroid. Those parts handle things like the lens and blood supply.
Okay. And the sources really emphasize a difference compared to dogs.
Yeah, they do. They point out that in cats, this melanoma tends to be flat and sort of spread out. Diffuse is the term they use. It's not usually a raised lump or nodular like you might see more often in dogs.
Interesting. Flat and diffuse.
Exactly. And the material says, initially, it might even look harmless. Both when the vet examines it and maybe even under a microscope initially.
Okay, but here's where it gets really, well, striking based on the sources. This potential for it to metastasize, to spread elsewhere, but years later. That seems unusual.
It's a critical point the material highlights again and again, that delayed potential for spread. And the sources actually give different figures on how often this happens. One study mentioned suggests up to 63%, but another found it in only about 8% of their cases. So some variation there.
Quite a range.
And the material also notes that if secondary glaucoma develops, that's the high pressure inside the eye, that might increase the risk for metastasis later on.
Wow. Okay, that delayed spread is definitely something to keep in mind. So who gets this? Any specific cats or ages?
The sources say there's no particular link to sex or breed. Age-wise, the average is around 9.5 years old, but really it can affect any adult cat.
Got it. No specific breed, mostly middle-aged to older cats.
Yeah.
So what might an owner actually see? What are the signs mentioned in your sources?
Well, historically, the common thing owners report is noticing changes in the cat's iris color, which
Right.
looks different. And if that secondary glaucoma kicks in, you might see a dilated pupil mydriasis, they call it, or even an enlarged eye, which is ophthalmia.
And those can lead to blindness.
Yes, unfortunately, they can.
Okay. And when a vet takes a look, what findings are described?
The physical exam details in the material include the iris surface looking thickened, maybe irregular, usually more pigmented, darker, though they do mention non-pigmented cases can happen too. The lesions themselves can be just one spot, focal or more spread out, multifocal or diffuse. Typically flat, they tend to grow slowly, and it could be in one eye or sometimes both.
And what about signs that things are more advanced?
Right. For more advanced disease, the material mentions seeing these little pigmented tumor cells actually floating in the fluid at the front of the eye, the aqueous humor. Also, the iris might get sort of uniformly thickened, which can mess with the pupil shape and how it reacts to light. And they note infiltration into the drainage angle. That's where fluid normally drains out.
Yeah.
That blockage is often what causes the secondary glaucoma.
Okay, so seeing any of those changes, especially the color change, definitely means a vet visit. How is it diagnosed then? And crucially, how do they tell it apart from other things that might look similar but aren't melanoma?
That's the differential diagnosis part the sources cover. It's really key to distinguish it. For instance, there are benign pigmented spots, melanocytomas. Think of them like iris freckles. The key thing the sources stress is that these don't change over time.
Ah, okay. So if it's just a spot that's always been there and isn't changing, it's likely not this melanoma. Good to know. What else?
There's also heterochromia irides. That's just when a cat's born with different colored irises. It's congenital, doesn't progress. And sometimes you can get a diffuse color change from chronic anterior uveitis, long-term inflammation. But usually the history of that inflammation helps tell them apart.
Makes sense. History is key there. What about physical changes to the iris itself?
The sources bring up iris atrophy. That's where the iris tissue actually thins out. You lose the front layer, the stroma, so the pigmented layer behind shows through more. It can look like thin spots, holes, or you might see light shining through differently. And finally, they mention limbal melanomas. These are usually benign growths near the edge where the clear part meets the white part of the eye, typically just one spot, often near the top, flat or maybe slightly raised. And importantly, they usually don't invade into the eye unless they get really big.
So lots to rule out just by looking carefully. What other diagnostic steps do the sources mention?
Standard blood work, biochemistry, urinalysis, usually normal, the sources say. For more expensive lesions, imaging like chest x-rays and abdominal ultrasound is recommended. This is really to check for spread, for metastatic disease before surgery, and then maybe repeating scans every 6 months or so if the removed tissue, the histopathology, shows the disease was quite expensive.
Okay, so looking for spread elsewhere, what about tests on the eye itself?
A full ophthalmic exam is critical. That includes checking the eye pressure tonometry and looking at that drainage angle structure gonioscopy. The sources do mention procedures like fine needle aspiration, sort of vacuuming cells off the iris, or even taking a small iris biopsy. But they also state the diagnostic value of these is pretty questionable, and they don't really help with staging, like figuring out how far it's progressed.
Right, and this seems to tie back to that really difficult feature of this condition, the delayed potential. The sources say finding tumor cells in that drainage angle or nearby vessels suggests spread might have happened. But you might not see evidence of that for years.
Exactly. That delay makes early diagnosis and staging incredibly tough. You just can't be sure, based on the initial look or even a small biopsy, whether microscopic spread has already occurred.
That definitely complicates things. So given that challenge, how do the sources say feline uveal melanoma is usually treated?
Well, the material makes it clear there's no single answer. Treatment decisions depend on a few things. Things like the cat's age, how fast and how much the lesion is growing, the specific ophthalmologist's approach, and also how worried the owner is about the potential for it to be malignant.
So it's very case by case.
Yeah.
What are the different strategies outlined?
Okay, so for an older cat, if the lesion is progressing very slowly, the sources suggest maybe just watching it closely. Periodic exams, taking photos to track changes over time. A conservative approach.
Monitoring. Makes sense for slow cases in older pets. What about the opposite?
Right. For a younger cat where the disease is moving quickly, progressing rapidly, then removing the eye enucleation is definitely a key consideration mentioned.
Are there any options for smaller, maybe isolated spots?
Yes, the sources mention laser treatment, laser photoablation using a diode laser. This has apparently been successful for small, freckle-like lesions, but, and it's an important but, the material notes there aren't really good long-term controlled studies on this method yet, so limited data.
Okay, laser's an option, but maybe needs more research. What if it's more spread out, diffuse, but not necessarily progressing super fast?
For that mild to moderate diffuse involvement, the sources say most ophthalmologists tend to prefer that conservative route, regular checks, photos, just monitoring. Enucleation is still an alternative, though, even in these milder cases, especially if you can document that it is progressing or if the owner is just very concerned about the malignancy risk.
Right, owner concern plays a role too. And what about those more advanced signs we talked about earlier? Pupil changes, glaucoma.
Yeah, if you see extensive iris involvement causing those pupil shape or movement changes, if the tumor is clearly extending beyond the iris, invading the drainage angle, or causing secondary glaucoma, then the sources suggest enucleation is the way to go.
Okay.
But here's an interesting finding mentioned in the material. One study apparently found that cats with just iridal thickening and angle involvement, even if they had glaucoma or didn't, had similar survival times compared to healthy age-matched cats.
Really? That's surprising. So just having that angle involvement didn't automatically mean a much worse outcome in that study?
Not for immediate survival time, based on that specific point, yeah?
Right.
But it's a contrast to what they call truly advanced lesions. Lesions described as deeply infiltrative, getting into the back layers of the iris, the posterior epithelium or the ciliary body. Those were associated with decreased survival times. And the source presumes this is due to metastatic disease finally showing up.
Ah, okay, so there's a distinction there.
Right. And they also add a little note about surgical technique, use a gentle touch during enucleation. They mention, just as context, that rough handling and human eye removals has been linked to promoting metastasis.
Good point on technique. And are there any meds mentioned that actually treat the melanoma itself?
The sources just say NA for that. No specific medications listed to target the tumor. Treatment is really about managing complications like glaucoma or removing the tumor surgically.
Got it. So let's pull this all together then. What's the overall outlook, the prognosis for a cat with this, and what kind of follow-up is needed?
The prognosis, according to the material, is considered guarded, and they explicitly say even with enucleation, which brings us right back to that key issue, the delayed metastasis. The spread might not show up for years, or maybe it's only found incidentally during a post-mortem exam later for some other reason.
That delayed spread really looms large here. Does the way the lesion looks when it's first found give any clues about that long-term risk?
Yes, it seems to. This is highlighted as a crucial finding from a long-term study mentioned in the sources. It suggests that cats diagnosed with what's considered early iris melanoma don't seem to have an increased risk of life-threatening spread compared to healthy control cats.
Okay, that's somewhat reassuring for early cases.
But on the flip side, patients with advanced lesions, those deeply infiltrative ones we discussed, had dramatically shortened survival times.
So even though the initial look can vary one spot, spread out, color changing slowly, it sounds like the real determinant for long-term outlook based on these studies, whether it fits that early versus advanced profile.
That seems to be the key takeaway, yes. Those advanced signs, the cells floating in the eye fluid, the thickened iris messing with the pupil, deep infiltration, those appear to be the markers linked to the significantly worse prognosis in the cited research.
Understood. So what about follow-up? If surgery isn't done, or even afterwards, what monitoring is recommended?
If surgery enucleation is declined, the sources recommend monitoring the eye pressure, the IOP, about quarterly. They do mention that mild pressure increases can sometimes be managed with meds, eye drops like dorzolamide or brinzolamide, or an oral drug, methazolamide. However, a really crucial point highlighted is that secondary glaucoma that's caused by the melanoma is best controlled by removing the eye, by enucleation. Meds might not be enough long-term.
Okay, enucleation is key for melanoma-induced glaucoma. What about checking for that dreaded metastasis?
Yep. Periodic monitoring for spread is recommended. The common sites listed in the sources to check are the liver, the lungs, and the nearby lymph nodes.
Okay, regular checks of those areas.
So yeah, what we've really pulled from these sources is that this feline uveal melanoma is, well, it's a complex condition. Often starts subtly, can be slow growing for a while, and telling it apart from just benign changes needs really careful examination.
And I think the most maybe impactful point is that potential for metastasis turning up years later, and how much the stage at diagnosis seems to matter for the long haul based on the studies you shared.
Absolutely. The material really highlights this balancing act, careful monitoring, especially for those slower cases, versus deciding on surgery when things progress or show advanced signs. All while understanding that even removing the eye doesn't completely wipe out that possibility of delayed spread.
It really hammers home that any change in your cat's iris color, while it could be nothing serious, is definitely worth getting checked out and monitored.
Yeah, and it raises this really important question, drawing directly from these sources. Given that potential for delayed metastasis and the big difference in outlook between early and advanced lesions, how do you or the vet and owner weigh that decision? Do you monitor a slowly progressing lesion conservatively, or do you intervene earlier, knowing that even enucleation isn't a 100% guarantee against future spread? It's definitely a complex consideration based on this information, something to think about.